to Talking Teeth, episode 3. I am from Italy. My name is Dr. Dean. I would like to welcome you to Talking Teeth. I love Italy. Welcome. How are you guys? I'm Dr. Dean from the New York Smile Institute, and with me, the beautiful Becca Morris, and her IG is Fashwolf, at Fashwolf, House of Concetta. That's how we got to the Italian part. Dr. Pulio Silva here with at Dr. Silva on IG and Silva Dental in Comac, Long Island. Welcome, welcome. You were traveling around the world.
Yes.
We had a couple of we were supposed to do a couple of shows, but we were busy. Got a little bit busy. She's traveling the world. I can't do the show without her.
Life gets in the way.
Life gets in the way. He's got like 1,000 kids running around the DR, so I got to figure it out. Anyway, we're here to talk about smile makeovers, amazing surface, that billion-dollar business in the world, all around the world. Smile makeover is one of those things that people want, that also people strive to get, and really, really changes their lives. It really just changes their lives in so many ways. So the first thing we wanted to talk about is what is a smile makeover. I mean, you can look online and find out what it is. Pretty much 90% we're talking about porcelain veneers, porcelain, ceramic, beautiful porcelain veneers that change the smile. Now, a lot of times there's a lot of expense of these. They become very expensive. Yeah. So there is a second option, which is called bonding, direct dental bonding on the teeth, which also looks amazing, just doesn't last as long, and it's not perfect in terms of the glossiness and the glass finish, but it still gets people through their marriages, their weddings, their any kind of photo shoot that they want to get to. So let's go start into first, why is it so popular? Why is this such a great thing? I mean, people kind of know it is, but let's kind of hash it out. What's really popular about it?
Well, I think it's because your smile totally changes your face, and
right.
It gives you confidence, and it's completely changed some of my disposition as well. Going through, I'm more outgoing. I'm able to be more confident in business, with friendships, all of that. So I think it's and also the word of mouth. People see me in person, and then it's just a chain reaction.
So it's a big self-esteem issue.
It's a feel-good.
Yeah.
It makes people feel good.
Right.
Yeah.
Many people have gone through their lives with not a confident smile, and they have the opportunity to go through a treatment. It changes their lives.
Right.
They see it on social media. They see it on pictures and friends and family. So if you're on social media, it's a thing. People do talk about their smile.
Social media has changed smile makeover demand, like tripled.
Yes.
Because now people are always like on the camera, so they're like, I got to do my teeth. I have patients that come to me say, I'm on Zoom all the time, and my teeth are horrible. I got to change my teeth, and I see it other people's teeth. So it becomes this thing in our world that I think is changing even more than it already was, and that's why you're seeing this popularity even grow even larger from when we started 20 years ago. So self-esteem is a big thing. I think I've seen personality changes.
Yes.
Right?
Yes. Of course, patients become more confident. It's like a beautiful smile is a beautiful smile. The person perceives that, and they kind of like take it on them. They become that next persona they want to become, and the rest speaks for itself.
Yeah. So something else I see that also I hear patients say, it's something I always wanted to do. Now, you had an experience. A lot of children, young children, adolescents, they get into accidents, including myself. I became a dentist because I used to box as a 14-year-old kid, like a dummy, and I broke my teeth. So a lot of children and adolescents, they go through these accidents, bicycle accidents. Now with these scooter mopeds and electric bicycles, once a month, we're getting kids flying off their bikes. They don't have helmets. They're breaking their teeth. Once a month, I get a phone call. And so what happens as a child when you break your teeth, they kind of fix it, they kind of put it together, and now their patient's 20 years old, 30 years old, and like, I always wanted just to fix my teeth, right? I mean, it happened to you.
That's why I've had this implant since I was 18 years old, and I mean, this is now your beautiful crown, but I was so self-conscious about it. I was really scared to have any dental work after having this implant, and it always kind of was in the back of my mind, just like if I could just have a great smile, I would
for your
feel
life,
complete.
like your life. You're thinking about this every time you brush your teeth and
Every
you're looking
time,
in the mirror.
Yeah, all photos, everyone is filtering their photos now too. You can just like create a beautiful smile on Instagram, but it's real life, you know? I'm meeting people.
Hey, listen, the filters definitely help.
Yeah,
Definitely help.
right?
They
Yeah,
do
but
help.
now I don't need one.
I had the best testimonial and the best feedback ever was that, wow, the patient said, I don't have to Photoshop my smile anymore.
Right.
I'm seeing my face.
Right.
And I didn't know that was a thing
Yeah.
that goes
Yeah.
through patients' head.
Yeah.
But they do.
It's-
And
it-
when I heard her say that, I was like, wow.
Yeah.
It's definitely a
lot of
thing
people.
because I saw patients coming up to me and say, well, this is what I do when I do when I have my filter. I go, well, that looks really good. She goes, can I get that smile? I go, yes, we can give you that smile. And the other thing is also, I think that you touched on it before. People have a fear. There's a fear like I want to get it done, but I have I don't. Am I going to go into the right doctor? Am I going to really do it the right way? So it's like I've been wanting to do this thing for so long, but is it going to be what I wanted? So there's a fear factor.
Yeah.
Are they going to hurt my teeth if I do this?
Yeah.
You know, so that becomes a discussion at the
But
consultation visit.
Choosing the doctor, that's like, you brought up a good point. How does a patient know who to go to visit?
Yeah.
And I would say first, look at their social media. Everyone's putting their content on social media.
Yeah.
Look at their website. Look at their Google reviews. Look at the patient's testimonials. If
Right.
the patients are verbally saying things and talking them and writing it, and then the proof is in the pudding, it's on social media,
Yeah.
Yeah.
then you have a good
I would
chance
say
of having
I would say also that I think the best referrals are from friends and from seeing it live.
Yeah.
Right? One of the things we talk to our patients is when you're finished, please tell your family members, please show your teeth. And they actually do. They go out and they show it. And I think that you brought up earlier was, well, are they going to look real?
Yes.
I mean,
That was my biggest apprehension going into it once I got over, the medical, fear of a procedure. I was really worried because sometimes you see them and they look bulbous or, like big horse teeth and they just look so fake
Yeah.
or way too white. And I was really worried about that. But I realized after I went through it, if you have the right dentist, they won't let you go too white or too perfect looking. I don't
Yes.
want people to say, oh, your veneers look great. People just are like, oh, you look, something's brighter about you.
right.
And I
Because
love
it
how
fits
people.
your face.
Right.
So that's another thing that you have to understand. When you go to a dental office, and I'm sure their good reputation's great, how they approach the smile design and how they approach it is a very interesting thing. So I'm going to say something that we know in the dental field for the people out there who are non-dentists. When the office gives you one or two or three choices, like you said, like this is your choice of your smiles, it's not customized to your face. The biggest thing about looking natural, obviously, is the actual veneer that has a translucency like a contact lens. It's very, very thin, so it picks up the color of your own teeth. So if your teeth are super dark, well, that has to be blended down so that the color becomes nice. If the teeth are already nice color and they're good color, you're going to be able to enhance it.
Yeah.
So the most important thing to understand for patients is that your face has a proportion to it. There's a mathematical equation that we go through with our 3D facial scanning, our intraoral scanning. Talk to them about what you went through,
Yeah.
about how our process to get the right teeth for her.
Right.
It's not just put the same teeth on everybody.
No.
Right. And I will start with a little comparison. I was in Maine last summer in, very remote area. I went to a dental practice, and for veneers, they opened a little pamphlet and they
Right.
had 3 or 4 photos and they said, pick which one you want. There's only 4 faces in the world, so I did not do that. I came here and you guys sat me down. You did a 3D scan of my face. You did a face bow, measured my bone structure, did all these calculations, took photos, everything, and created a custom smile
And then
for
we
me.
and then we
me
showed you. We showed you
yes, a mock-up
the
of what it would
simulation,
look like.
the simulation, smile simulation. To me, if the office is not giving you a kind of a look of that you're going to have, you
Yeah.
can't really evaluate what you're going to look
Right.
like. The
Every
smile
face is
simulation
different.
is big.
So it's the same thing I do in the office. When I do a consult for a patient, the first thing I do is take a picture of a smile, and the patient's like, why are you taking the picture of my entire face? Well, because I need to know how I'm going to fit the teeth in your face.
Right.
The treatment becomes customized from day one.
Yeah.
And then the patient starts getting more acquainted, understands the process, but it's a facially driven smile. You know, it's not just about teeth.
And that's why we say it's not just cosmetic dentistry, it's called facial aesthetics. It's not just your teeth, it's your eyes, your lips. Another thing with lips and Botox, that changes the smile. So I usually say to them, go get your Botox, get it all finished, that you love your lips, so I can make the teeth match your lips. And that's another issue. They'll start making their teeth really beautiful, but then they do their lips afterwards.
Oh, wow.
Then they're like, well, I can't see my teeth. I said, well, your lips are too big because you put too much Botox in it. I said, go get the Botox first, then we'll do the teeth. So then let's talk about who is a good candidate? Like, who is a good candidate for a smile makeover?
What do you guys think?
I have a lot of consults with teenagers, 14, 15-year-old, 16-year-old. They want to start doing whitening at 14, 15.
Right.
I'm a bit against that. I don't push it. But
Why
17,
not? Wait, why not?
Why? Right.
14-year-old wants whitening. What's wrong with that?
then they're going to go double down on that. By the age of 20, they've done so many sessions of whitening. Keep the teeth natural as much as possible.
I disagree.
That's my. I wouldn't want a child to go over and stress it for the age of 20.
I think it's how you talk to your children. My kids wanted whitening. They're in the dental business. Dad, whiten my teeth. I said, yeah, whiten your teeth. So I don't think it hurts the teeth. Does it hurt the teeth?
Everything in excess, yes. If they take the
Or are you worried about the psychological effect of the kid?
No, because eventually, they do other type of procedures at a very young age.
Right.
Sometimes they do plastic surgery that they need.
So what's your
They're
age
elective.
for whitening?
I would say 17.
Okay, so age size whitening, 17, mine's 16, not a big difference.
Yeah.
What's your age for a smile makeover?
What's the youngest you guys
What's
would
the
do?
youngest that you think we should do it?
Um,
Because that's an
Oldest.
issue. It's a real issue out there because the parents are coming with the kids. Sometimes the parents are crazy. Ladies and gentlemen, stop pushing the kid.
Yeah.
Parents coming in, I want my teeth to have veneers. The
Yeah.
kid's 14, relax.
Yeah. So
Do a little bonding, do a little whitening.
Yeah.
Okay, we'll get him to the veneers. But what's your number for the
sometimes
veneers?
let's talk about cosmetic treatment. Composite is something that could be done, but it could also be replaced without damaging
Right.
the tooth structure.
Okay.
Okay.
If I start doing porcelain and shaving down a tooth on a 14-year-old kid, now my options for future treatment become more
Yeah,
aggressive.
and that's
Makes
really
sense.
the big issue. It's like when you start the process, you have to know that they're going to last a very long time. So if you start at 18, 19, 20, you got to think about it. At 35, you probably have to do a redo, a revision case,
Yes.
maybe 4 of the front teeth.
Oh, wow.
Just has to do with growth.
Yeah.
It has nothing to do with the veneer. The veneer is going to stay on.
Okay.
But the body and the jaw and the whole skull actually grow. So there's a growth process that happens up to really about 37 years old. So the patient just have to know. If you're starting at 18, so what's your number for porcelain veneers?
Porcelain veneers, I would say 18,
Okay,
21.
so if you're
depending
starting
on
at
the need.
18, we let the parents know, let the child know, listen, look great, you look amazing, they're going to college, they want to look better. We had a
Yeah.
couple of 18-year-olds who just had really bad enamel. They just were born with bad enamel.
Yeah.
And the parents said, I just want my kid to look good when they go to college. They went abroad. And I said, absolutely. So, but I let them know, listen, at 35, at 37, another 20 years later, we may have to do a
There'll be
revision.
So how long do veneers typically last, would you say?
Well, I tell my patients they last a very long time. I have cases 26 years later.
Oh, wow.
Yeah.
What's the worst case scenario? One porcelain veneer chips off
Yes.
or chips.
Okay.
That happens.
Yeah.
We replace it. It's not a big deal.
Right.
It's one tooth. But generally speaking, I tell my patients 15 to 20 years. You're going to
Yeah.
get 15 to 20 years from that.
10,
And-
15 years,
Yeah,
it's
and
usually
then
time.
and then usually again the veneers they don't just fall off.
Right.
It's just that the body changes, and they'll get recession or the teeth themselves. Remember, when you're putting a porcelain veneer on a tooth, that never changes. The color never changes, but the back of the tooth, the original tooth, will change over time. So the translucency starts looking a little yellow. And I look at my photos from 10 years ago, 20 years ago. The veneer has the same color. The tooth behind it has
Has
changed.
changed.
So they'll say my veneers don't look as bright as they used to. Well, it has to do with your own teeth. Your own teeth
Right.
got darker
Okay.
over time, but the porcelain stayed the same.
Okay.
So the translucency of color, transmission of light will change over
Yeah.
time. And then they'll come in and they'll say, hey, I want to brighten them up a little bit. I had an 80-year-old. We talk about the youngest age.
Who's the
What's the
oldest?
oldest age?
Right.
Yeah.
Had an 80-year-old woman, her son was becoming a senator at Washington, and she says, we're going to be doing live shoots and live videos. my teeth look horrible. And I go, can you do it on an 80-year-old? I go, absolutely, let's go. Absolutely. And she looked great. She walked
That's
in and she looked great.
Yeah.
That's great.
Age should not be a factor, even to do any cosmetic treatment. It's just knowing how you are going to break it down for them. You know, don't promise that it's going to last forever, because nothing lasts forever.
Right.
So the four top questions that I get
Yeah.
are, am I damaging my teeth? How much is it going to cost? Okay. How long will it last? We just talked about that. And how many teeth do I have to do?
No.
So let's go into the first one. Are there teeth damaged with porcelain veneers? You just had your teeth done. Are your teeth damaged?
No, but I will say I was very nervous at the beginning because back in the day, everyone knows they shave your teeth down to little tiny
Nubs.
pins
Right.
and nubs, and that's what I was scared of. And I happened to sneak to the bathroom and look at them, and it didn't even look different.
Right.
Tiny, minimal, and it's so advanced now that it's not even a
So,
problem.
so depending again on the color of the teeth,
Right.
if the teeth are nice, like your teeth were natural, they were nice, they were good, they just needed to be enhanced. The layer of the total tooth size about 10 to 15 millimeters, right? We're literally taking off a half a millimeter. That's why they call it veneer. You're veneering the tooth.
Right.
So you're only taking off half a millimeter. In the worst cases, where the teeth are very dark, we're taking off millimeter and a half. So you're still maybe 10, 15% off the tooth. You're not touching the tooth. And a great example of this is when a patient says, hi doc, my veneer came off, can I come in and get a re-cementation? And they said, I looked at it, it looks like my own tooth. And that's how you really know that we didn't cut the teeth back. We just shaved a little portion off, like a contact lens, and put that veneer on. So we're not damaging the teeth.
We're not. And you just said it. The thickness is equivalent to a contact lens. That's how much tooth structure. And if you have a dentist who's doing a proper design of a wax up or a digital design, we know which tooth needs to be reduced and we know which tooth needs to be added porcelain.
Correct.
Because not all teeth need to be shaved down.
Right.
That's
Okay.
that comes with
Oh,
training.
that's interesting.
That
Yes.
comes with training.
Right.
That comes
Yeah.
with the knowledge of the doctor,
Yeah.
but also the dentist working with a good ceramist. If you
Alright.
have a dentist working with a top ceramist, someone who's invested time and hours in reading books about porcelain, they would know how to play with the colors of
Sure.
teeth. And guess what? Teeth are not white. They're not white.
Well, we talk about color, and like you said, if they're blocky and ugly and they don't look good. So we usually ask the patient, do you want European white, you want New York white, or you want California white? Right? So depending on the region that you go to, California has these super white teeth. That's what they're
Yeah.
looking for.
I actually throw away the whitest
Right.
shade tabs. I throw them
Yeah.
away. I don't
Right.
have them in my office
Yeah.
because I would never want to see a patient walking out with.
It's
I tell my patients, I want you to have beautiful smile, beautiful veneers done, and I want the first thing that people look at is your eyes. If they look at your eyes and they connect with you through your eyes,
Yes.
that is the goal of a beautiful, confident smile.
Right.
I want them to say, did you get a haircut? Did you do
Something looks different.
yes.
Yeah, you look different.
Were you in Florida? Did you get a nice
Yeah.
tan? They would never think it's your teeth.
Yeah.
Right. Right.
So,
Let's go to the most important part that people ask. Why does it cost so much?
Yeah.
How much does it cost? What's the cost factor? Generally speaking, veneers, depending on the area that you live in, can be as little as $1,500. It could be as much as $4,000, depending on who you're going to and where you are. It doesn't mean that one is better than the other. Obviously, their talent has to do with it.
Yeah.
So you have the doctor, and then you have the ceramist, which is what Dr. Puglia was talking about. The artwork and the art design of actual porcelain to be on your tooth has to be done by a master ceramist. So a good question to ask, it's not being invasive, says, hey, Dr. So-and-so, who is your laboratory? So find out about the laboratory. You should be conscious. Today's world, you can look up people and find out, what kind of work they do. So I think as a consumer, you want to know the dentist, understand it, get a good consultation, and know the laboratory. So at least you have a confidence, and then look at the pictures, look at the after, so you can see what you're going to get. So the cost factor is an issue. A lot of people want to do it, they just can't afford it. So alternatives is bonding. Even if you do 4 teeth, sometimes 4 teeth in the front. If you're going for a photo shoot, you're getting married, or if you're going to a show, and they're taking a lot of pictures, 4 teeth bonded is a very good alternative to that. Now, the other alternative is financing, just like you do a car, right? You finance it. There's financing options at the offices. We have financing options. Pay it off over the course of a year, 18 months. You save for it. It's a good idea to save for it and try to do that. We also have here at the New York Smile Institute, we have our FMR course. And our FMR course basically is 50% of the fee. People can't afford it, but we have doctors learning. So it may not be me doing the case, but it's another doctor doing the case. So I think if you actually really, really want something, you can always call us at the New York Smile Institute and we'll give you avenues. If you're in Westchester, if you're in Texas, we have doctors that are part of our FMR family, and at least you know you're going to a doctor that's somewhere in your area that has at least taught us with us and learned with us and has been part of our family.
Yeah.
So we have an FMR network of dentists around the world, actually, even in Poland or Italy. I love Italy. Even in Italy, in Greece, in Spain, in Russia, we have patients and doctors around the world that we can share that with you. So just know that the cost is always going to be an issue. How much you're paying, ask up front so you're not surprised and there's no hidden fees. We always tell our patients what the cost is going to be. Okay, how long will it last? We went through that. How many teeth do I have to do?
That's a big one.
How many teeth do I have to do?
And that's a beautiful,
How do you determine that?
That's a beautiful thing about a facially driven smile. I tell the patients, smile. Now smile like you really mean it. And when they really mean it, they're going to show you all the teeth that show.
Yeah.
And if their perspective of a beautiful smile is getting 3 shades lighter, and they want to do just the front 6, I show them the picture of what it looks like
Right.
to have only the front 6 teeth
Ah.
whiter, and their
On back.
full smile showing the other darker teeth.
Right.
And then they're like, oh, now it makes sense.
Right.
Yeah.
So it's basically a smile rehabilitation that the patient has to understand that there's a give and there's a take. You want whiter teeth, or you want just better shape of your teeth,
Right.
same similar color.
Right.
Because that could be
Right.
done.
So that's
Yeah,
also the
okay.
color issue. So if the patient's coming in with a certain color shade, that's maybe they're coming in with light teeth and they just want to change the shapes. Yeah, I could do 4 teeth and it'll actually look really pretty. But once they say I want to change colors, and usually it's 2, 3, or 4 shades, you got to do at least 8, if not 10 teeth.
Right.
Yeah.
You know, and then the other question is, do I have to do uppers and lowers? Now, again, financially, if they're okay financially, yeah, obviously it's better to do uppers and lowers. But if the finances are limited, we can do 8 on top and 4 on the bottom, right? So you're still at 12 teeth. So you're not at 10 and 20 teeth. So again, there's ways to work around it. I think the most important thing that Dr. Pupio said is you got to kind of be able to see it and say, yeah, okay, I think I want that. This way you're not getting something that you're not surprised with.
I had a patient, she come for a second opinion, she had 4 front teeth crown, and they were 3 shades lighter. And I said, let me give you the opportunity to see what I'm trying to say with words, but let me show you and give you a smile test drive.
Right.
We did a full smile design, and I overlaid the mock-up of her teeth,
Right.
and I showed her. And immediately, it just turned the light bulb on. It's like, now I get it. This
Yeah.
is why I always wanted to fix my fangy tooth. Now this is why this tooth was pushing out. Now this is the color. This is what I want. And now it made more sense. But
Right.
that's where it comes to, who are you going to for these cosmetic evaluations?
Right.
Who's your doctor? Who's your dentist? How are they teaching you? How are they
Right.
educating you? So that's key.
We had another question online before today. Someone sent me and said, if I have a gummy smile, can I still do a smile makeover? So let's talk about that for a second. Some people have nice teeth, but their gums are too much. They're too gummy. Okay, and they're smiling and they just show too much gum. Theirs different. Now you have to not just change the teeth. Now you have to do some kind of procedure to move the gums up. It's a surgical procedure. All right, so now that changes the whole smile makeover because you have a 2-step process. You have the surgical piece that has to heal with the gums, and then they can go get their smile makeover. So that's something that happens to a lot of patients. Their teeth kind of grow, the tissue grows over, and when they're smiling, they're too gummy. So understand that is very different. It's 2 separate procedures. Usually a periodontist specialist does that part, and then we do the smile makeover after that. So just to clear up that thing.
I would like to say that a smile makeover, let's call it, but it's not just about the white of the teeth. It's also about how the pink create
The
harmony.
pink tissue, yeah, pink
Pink
tissue.
being the gingiva, the tissue.
Wow.
How does that create harmony in the patient's smile? There has to be some percentage of pink showing, you know, and when a patient smiles, you want teeth to look natural.
Yeah.
Yeah.
If they're all super white all the way to the top, and no pink showing, like square white teeth, it's off.
Yeah, it's
Yeah.
off. What are the disadvantages? Someone said, what are the disadvantages of doing it?
The only one is just the paying.
Yeah, the price,
having
the
to,
price,
you know,
the price
save
is
up,
the-
but with FMR, you know, it
Somebody,
was good.
somebody talked about the sensitivity. So have you seen sensitivity in your porcelain veneers?
Yes, there's sensitivity. It happens in the first few weeks of it. One with the provisional phase,
Right.
where you're trying it on, and we've already recently shaved down the tooth, or also that we had some gum surgery. But it adjusts over time very quickly.
Right, so one of the things that we didn't discuss yet that brings up the point of sensitivity. The way we do our smile makeovers is we have a two-step process. The first step process is to get the smile makeover and the trial smile, which is the provisionals. So the patients walk out with a simulation of exactly what their finals are going to look like. So they have that 2-week period. Sometimes it's 1 week, sometimes it's 3 weeks, so they can get used to it. So having that phase of 2 weeks with the provisionals and smiling and being able to test drive it, so they can, right? You had your for about a month, I think you had yours.
Yeah, I had them.
Right, so just to see, oh, I want a little bit lighter, my teeth are getting sensitive, right? So the dentist needs to know that,
Right.
so that I can say, oh, that left tooth was sensitive, I can put a chemical bonding on it that's going to decrease the sensitivity. So sensitivity happens, it's real, and sometimes it's nothing, there's no sensitivity at all, and other people have a lot of sensitivity. So that provisional phase really allows us as a dental professional to say, oh, we have a sensitive patient here, I have to do something different. I have to do some more bonding on the tooth, I have to seal it better because this patient's experiencing that. So it really varies. I want people to know it varies from no sensitivity at all to a little bit of sensitivity. Did you have any on yours?
Minimal, very minimal
Yeah.
for the first few days with my provisionals.
Right, and then with the finals?
Not really.
Yeah.
No.
So again, everybody's different. You do get some people that
I-
kind of experience that.
I used to schedule the next day follow-up for those to evaluate the provisionals, and I realized it was too soon for the patient.
Yeah,
Right.
they have to have.
They didn't know what. They're just waking up to a new smile,
Right.
and they have so many thoughts in their head.
Yeah.
I give them 3 days.
Yeah.
By the third day, the patient comes back. We adjust the bite if we need
Right.
to. We adjust the shape of the tooth if it's too rounded or too square.
Right.
We discuss color.
Right.
You know, now the lips are no longer numb, which is an awkward smile at the moment of the procedure.
Right.
When a patient comes back, they've brushed, they've maintained a bit, they've spoken with it. Sometimes
Yes.
they're lisping because the teeth are too long. So it's all that is taken care of in that
It's
third
getting used
visit.
to it. Yeah.
Right.
At the third visit, and then we meet the patient's expectations of what they're looking for.
Yeah.
Yeah.
We take a picture again, we take a scan of the actual impressions of the provisionals, and now I communicate the changes to my technician. That is what it means to have a good communication with your
That's a big
professional.
big part of it, because a lot of times I hear, because again, we see patients after their smile makeovers that weren't happy. We do a lot of revisions. We do a lot of redo cases. They travel back to New York and they say, I'm not happy with my smile. And most of the time, the disadvantage that I see is that the dentist and the patient lost some communication there. She wanted lighter or she wanted rounder, and she didn't get to see it, or they didn't get to check her. The ceramist and the laboratory didn't get the message, and something got disconnected. And either they were too light, or they were too dark, or they didn't get the right size, it didn't fit their face, they were too bulky, whatever that is. And that has to do with exactly what you said. Communication is a key point to smile makeovers from the beginning to the provisional to the end. There has to be a constant discussion. I have my patients on my cell phone, we're texting back and forth, and they'll show me pictures. I really want to look a little bit more like this. I really want to have the square piece. I really want to have more rounded. There's constant communication so I can understand. My husband doesn't like it. They're too light. My wife thinks they're too big. Whatever. I take it all in and I start massaging that case and saying, hey, I got to make it exactly what everybody, so they're happy in their lifetime. A big thing that we see on Smile Makeovers is we do what we do. We mathematically figure out the perfect smile. The patient wakes up the next day, they're like, these teeth are too big. Dr. Dean, they're too big. I said, wait 2-3 more days. Please wait 2-3 more days. I did my calculations. I'm pretty confident where I am. 3 days go by, 4 days go by. I'm starting to like my smile. Right? Why? Because somebody sees them and says, wow, you look great.
Oh, yeah.
What did you do? You look different. You look
Yeah.
amazing. Or somebody in the elevator will say, you have a beautiful smile. This is just with the temporaries. And then they go, oh, it is working. I
Yeah.
am starting to live it.
Yeah.
And that's why the period of 3 or 4 days is so important,
3 days
so they can live it. Now, if they come in and they say, hey, you know what, I looked at it, it's still a little bit too long, no problem, let's make the changes. And then they'll go for another 3-4 days and do it again. So that communication, constant feedback back and forth, I gotta have it. I have to make sure I'm doing the right thing so that I'm putting back the final that's gonna look like the patient wants.
And for the occlusion bite side
the
of
whole
it
bite
as
is a whole
well,
nother thing, yeah.
it's good to have a few days to get into your normal routine and habits and see how, you know, this is rubbing or this is, and from, you know, not just an aesthetic standpoint, but
I want to talk about the communication with technician and choosing the right technician for the case. I'm big on social media. I see a lot of content, and I identify a doctor's design of style of teeth because they use one lab, one design, one library, and they're all teeth and all the smiles look the same.
Yeah, yep.
I have about 3 technicians that I know the personality of the patient. I know the design of that technician. Who am I going to choose based on that?
Yeah, that's really, really
That's incredible.
customizing it.
Wow,
That's really
yeah.
customizing it.
Because
that's,
I am not going to give. I know the ceramics who likes giving character, gives it more mature look to the teeth and more staining and glazing and shape and crooked teeth. No, I'm not going to give that to a 25-year-young professional who wants to look more younger. I choose the right technician for the case.
I just got this text message from one of our patients that we did. Again, finances was an issue. We gave her a little bit of a break, and I want to read to you because she just texted me. I've always been content with my smile, but I knew I needed some work. The results from the New York Smile Institute have exceeded my expectation. My new smile not only boosts my confidence, but also enhances the opportunities of my journey of my life. I'm thrilled of the transformation. I'm getting goosebumps. Excited about the future holds for me. Thank you, Dr. Dean, and your staff.
Wow.
They've made it best experience for me and their amazing customer service support. Let me talk about that. To create a customer service, now I'm talking to the dentist for a second. To create a great office environment, you have to have great staff members, and you have to think about the Ritz-Carlton philosophy of customer service. When that patient's coming in for a consultation, we have to make sure that they're feeling that we're here for them. The vibe is positive, the music is good, and we're here for them. They need to feel that confidence because they are fearful. They are spending a lot of money. It's a big investment for themselves, and it's a personality thing. They are literally changing their personality. And a lot of times they don't even know it. I have a story. There was a very wealthy, successful gentleman that came to us, referred by a friend. He was, right before COVID, he was very successful. His teeth were bad. He always wanted to change his smile. Very, very off, not just a smile makeover, but a bite change and occlusal change. It was a very complicated dental procedure. And he came to us, we did the consult, and he was ready to go. And I said to him, I said, you're going to be I said, I know you're successful. You're going to be so much more successful than what you already are. And when I said that to him, he's like, what are you talking about? I got everything I need. I'm good.
yeah.
I'm like, you're going to be even more successful. That gentleman not only had COVID happen, right? So COVID happened, so he was on Zoom. He was on Zoom with whoever was on Zoom at that day, and he was smiling so big. And the people on the other side like saying to him, wow, you look really good. Your smile looks great. You got a beautiful smile. And his personality just changed. He sold his company for $300 million. Not because of his teeth, because of his, but may I say because of his teeth. It's because of the confidence that he felt in himself. And he came back to me. He does testimonials for our FMR group. He literally comes to our group and tells him how successful he was and how it changed his life. And I can't tell you how many of our patients 5 years later, 10 years later, I say to them, was that the best investment you ever made? And they're like, Dr. Dean, you told me it was going to change my life.
Right.
I didn't believe you. I thought you were crazy. I thought it was like a line that you were giving me. And he goes, you are 100% right.
Yeah, I'm 6 months out and I feel it's already changed my life.
Yeah, but look where you were before. Look where you are now. You're on podcast now. Can't be on a podcast without a smile.
No, you can't.
Right? So her life totally changed. Now, here's the biggest thing. And I say to my patients afterwards, right, after they had it, I'll say, what do you think the value, what's the value of your dentistry now? Would you change that, go back to where you are? And it's so funny, because psychologically, people forget what they look like. And I'll say, hey, remember this photo? They're like, oh, no, don't show me that photo. That's what I look like. Oh, my God.
Yeah.
They forget. So the question I have to the public, and again to my patients, what is the value of that smile? Would you rather have a Chanel bag? Would you rather have a Rolex watch? Or would you rather have a perfect smile? And that's exactly what I tell my patients. Don't say Chanel bag. She lost it for a second. She, I don't know. Chanel bag's beautiful. It's in the closet half the time. Your watch is beautiful. You get bored of it. Let me tell you something. Your smile lasts every day you live, and you share it with everybody, everywhere you go. It's constantly with you. You get bored of a watch, you get bored of your clothes, you get bored of your car. You never get bored of your smile. So that's my message to everybody. Testimonials are very important. Another question was, what if I have an old implant or old crowns? Can I still get the smile makeovers? Now it's not veneers, now it's regular crowns. And again, that becomes a little bit more expensive and a little bit more time consuming because we got to take off all the old dentistry. The implants have to be changed. I had to change your implant. And it becomes a little bit more involved. So I want to really be clear on for people out there, when you have crowns and other work that already been done, and you're, just things that happen. Like in my case, I had old crowns and old posts and old root canals. I had to get it all off and then start the smile makeover. So it's not just a smile makeover with veneers, it's crowns and implants and other things. So those become more complicated.
It's a more comprehensive procedure. Removing the old veneers, it's more labor involved. You don't want to destroy too much because you don't know what's underneath the old crowns or ceramics. So it just takes more time to restore that.
Any last thoughts
But
before we
it's
say
doable.
goodbye? What's your word of the day?
My word of the day is life-changing.
2 words. Life-changing.
It's hyphenated.
Life-changing.
Life-changing. That's what
What's your
it's
word of the
done
day?
for me.
It's your life is a journey. If you're going to invest in your smile, do it once, do it well.
Yeah.
That's it.
Do it once, do it well.
Do it
That's a
once,
great
do it
statement.
well.
Thank you for joining us here on Talking Teeth, episode number 3, Smile Makeovers. I hope you learned something, got a little bit out of it. If you need a consultation, we're here at the New York Smile Institute. You can come visit us at the FMR course and definitely follow the beautiful fashion wolf, Concetta, House of Concetta, and Dr. Silva. Thank you for your time, guys. Thank you. You guys are great.
Thank you.
Thank you. Have a great day, great
Bye, you
weekend.
guys.
See you soon.